People do need to keep checking our booking website because as we have staffing come in and we can extend hours, we'll be opening up more bookings, and we've certainly been looking at opening up more Pfizer bookings over the coming weeks. So that's really where I've got to with my update. People will have seen around Australia, and as the Premier said, that Queensland has now introduced a lockdown in certain areas, and of course Perth and Peel have now had a lockdown. I don't want to have that here. It is so harmful, it's damaging for our economy, it's awful for us as people of our state to have those lockdown orders. It impacts us socially and economically. I do want to thank everybody. We had to bring this raft of restrictions in yesterday. I just wanted to thank everybody. I know there are places now where masks are being required, such as in aged care and also in our hospitals, also in nail technicians and beauticians and hairdressers. So there's probably people in our plaza today where there is a requirement for masks. And if you're catching public transport, as my couple of my kids were doing today, I told them take some masks please, because it's not mandatory in public transport, but it's highly recommended. And then just another point I wanted to make on the aged care facilities, and the aged care facilities are now aware of this, but it came into the direction as well last night. We didn't mention it at the press conference, but we wanted to be able to, rather than put restrictions on visitors across aged care in South Australia, we've decided that if an aged care facility has more than 70% of their residents vaccinated, there's no restrictions on visitors, and that's indeed 89% of aged care facilities in South Australia. But the 11% where there's less than 70% of residents will have a requirement to reduce visitor numbers down to 2 per day. And that's just as an example of where we're moving to nationally and also in South Australia, that if we know we've got high rates of vaccination, we can just make different decisions in terms of these sorts of restrictions.